Joining us at the desk right now is a guy we had a chance to meet yesterday over at Broadlawns Medical Center. And if you have not been to Broadlawns lately, ladies and gentlemen, you really need to do yourself a favor and go make a stop there because you will be amazed, Jackie.
All right, well, we're going to focus in on something specific this morning.
The technology they have over at Broadlawns will knock your socks off, and Dr. John Tenninger is joining us right now, radiologist from Broadlawns, and just some of the things that we've learned over the past several months that we've had a chance to visit with the Broadlawns people just blow you away. And you are involved in an area that is simply amazing.
Yeah, and I mean, in imaging, we've had a lot of growth. I mean, if people have never been there over the last 10 to 15 years, Broadlawns has changed tremendously. In the imaging department alone, we've had a lot of capital investment into there. We've got, we do all our mammograms with 3D mammograms. So we were actually the first place in Des Moines, actually the first place in the state of Iowa to even offer 3D mammography.
Really?
We have a newly remodeled mammo suite, as you're showing up there on the screen. The other thing is we updated our MRIs, and so we did a brand new MRI suite, and it shows that all our MRIs are done on a 3 Tesla magnet. So when you have an MRI done, there are different magnets. Not every MRI is the same. The higher the magnet, like a 3 Tesla versus a 1.5, allows you to get better images, allows the exam to be a little bit faster, so you're in the magnet a shorter amount of time. The other thing we did last year was we completely upgraded our ultrasound department. So we have all new, brand new top-of-the-line Toshiba ultrasound units. And a couple years ago, we actually bought a laser and started treating chronic venous insufficiency and venous ulcers.
And that's one of the areas that you specialize in.
Yes, yep, I do. And we see patients all day long in the vein clinic. And what we do is, it was kind of an interesting thing. We initially started it to help several of our patients who were being seen in the wound center who had these ulcers. And some of them, these are young people. Some of them were like 30s, 35, and had had these ulcers for years, being treated, just kind of wound care, compression, and they came down and said, is there anything else we can do? And I said, yeah, we can actually, let's treat the underlying problem to allow that to heal. And so that's when we kind of started doing laser ablations where we close the veins, and in coordination with the wound center, we're healing these ulcers up.
And that is something that it's almost like magic, isn't it?
It is. We used to even, not that long ago, you do vein stripping, and everybody's always heard of that, and they're like, I'm not going to treat my varicose veins, or because I've heard of this big procedure. Now the procedure can be done either with a laser, or some places use RF, or some places are even using chemical ablation. There's different ways to do it. But the whole disease happens because the veins have to carry blood back to the heart.
Right.
And so there's valves inside those veins so that when that blood pumps up, the valves have to catch it so that the blood doesn't pool down in your calves.
Got it.
So some people have a genetic predisposition to have either bigger veins or weak vein walls, or the valves in the veins are a little bit floppy. So that blood kind of pools back down in the calves, builds up pressure in your calves called venous hypertension. Like your high blood pressure, it's high blood pressure down in your calves. The body doesn't like it, and it kind of induces an inflammatory response.
So it'll swell.
Yeah, the vein itself will swell, and then what will happen is the veins will become tortuous and dilated, and then eventually some of that fluid can kind of leak out, and you'll get swelling in your ankles. And then if you have it long enough, you'll start to get some skin changes, where some of the iron in the blood will kind of leak out of the vessels, and you'll get some staining of the skin. You'll maybe seen people with some brownish discoloration of the skin, or some reddening of the skin, and then eventually that skin's not normal anymore. It can get kind of fibrotic. And
we have some photos here. We want to let everybody know what we're talking about here.
Yeah, so that's an example of the skin changes. I'm not sure if they showed any other ones on there. That's called stasis dermatitis, and what it is that's kind of a chronic change from venous insufficiency. You can kind of see there's some reddening of the skin there, and even on that picture on the bottom, you can kind of see how that left calf is starting to get a little bit smaller. So the fat in the calf is actually being replaced by fibrous tissue, and it's getting real stiff.
Really?
And here's kind of an example of what we were talking about, how there's a progression of the disease. On the left, a lot of people will come in, have spider veins or little blue veins, and we'll do an ultrasound and realize there's more of an underlying problem rather than just what they see on the skin.
Is it normal if you're in your 30s or whatnot to see some darker veins pop up, or is that an immediate warning sign to say, hey, you should come in and just see what that's about?
No, it can be normal. Sometimes those spider veins, if you're talking about little spider veins or those reticular veins or those little blue veins you kind of see on your skin, they can be due to to other reasons as well. They can be hormonal. That's why with hormones, related to your hormones, but they can also be an early sign of an underlying bigger venous problem. And so then you get those reticular veins, then they go to varicose veins where they can get those more dilated.
And that's what people
veins.
are real familiar with.
There's a good example of those little blue veins. This patient has a little bit more advanced disease, but if you see these blue veins on the inside of your ankle, even if there's a few, it's like a lot less than that, that can be a really early sign. It's very specific for chronic venous insufficiency. Throughout the rest of the leg, it can be due to other things.
But this is treatable.
It is treatable, yeah, and it's treatable as an outpatient. There's an example of just the varicose veins that people typically see.
People are familiar with.
Yep. And then what we want to do is another example of the stasis change and how it kind of gets a little bit more narrowed and tightening, and then you get some swelling above it. And then what we want to do is prevent this. This is actually the very first patient that we did, and this is the reason that we actually started it at Broadlawns. This guy came down. This is a guy who had this ulcer for 5 years, being treated with wound care, and what we did is we ended up closing off his vein, found his underlying problem, and then over the course of, it takes a little time for that to heal up. Once it's healed up, all his pain is gone. He swims with his kids now. He's like ecstatic, and he thought he was just going to have this forever.
But isn't that an issue if you close off your vein?
Yeah, these veins aren't, so arteries carry blood back, arteries carry blood away from your heart down to your foot. The veins carry it back. The veins that we're closing off aren't working anyway. Yeah, so they're not doing.
So it doesn't really matter.
They're basically, the blood kind of comes up in the veins, and then it reverses and flows down, and then it kind of just eventually gets back to your heart, by your calf muscles contracting or using the other veins in your legs that are working normally.
So the blood will be rerouted then?
Yeah, exactly. Yeah, exactly.
So what did you bring with you this morning?
Well, I was just going to show you. I think that a lot of times people are always scared about what's going to happen. This is going to be a crazy procedure, and this thing's really long here.
Looks like you're going fishing.
Exactly. But we do the whole procedure through just a tiny nick in the skin. There's no stitches. You end up with a Band-Aid afterwards.
That's it?
Yeah, this is what we slide up in the vein. And I think there's a picture that kind of shows what we do is when you get the vein that we need to close, this slides up in the vein, and then we turn on the laser and we numb up around it.
I didn't know what that was yesterday when we were looking at that.
And then we pull it down and we heat it, and you can watch it real time, and it'll close the vein off.
No way.
And then you put them on a compression stocking afterwards to keep the vein kind of walls together.
Right.
And then eventually the blood will be rerouted.
It'll heal up.
Why do varicose veins swell the way they do? I mean, why are they so prominent on the leg?
Yeah,
what causes that?
Well, the reason that the veins get big is that the wall is weak. Okay, and there's some people are genetically predisposed to getting that, so that's why a lot of times if your mom or your dad or your brother or sister have them, that you're more likely to have them as well. And then having that increased pressure, let's say you have it for a secondary cause, maybe jobs that require you to stand for prolonged periods of time, pregnancy, obesity, sedentary lifestyles can kind of lead to that pooling down there. The inflammation that's caused by that venous hypertension will actually weaken the wall a little bit too, and that's why they dilate up. And then like arteries have real strong muscular walls, veins have a weak wall, and so when they get weak, they dilate up, and then the problem gets worse and worse and worse.
And then they don't work properly.
Yeah, and you can treat it conservatively too. I mean, that's the way they used to do it. And we do that initially too to see if that can take care of your problems. Put you in some compression stockings, elevate your legs at night, make sure you walk, because every time that muscle in your calf contracts, it'll push the blood out.
You have a lot of options.
You have a lot of options.
If you have any questions, folks, if you haven't seen Broadlawns lately, you really need to check it out. This is the number you're familiar with, 243-VEIN. Give them a call. They'll be more than happy to make some arrangements to come on in. Dr. John, thank you so much for your information. Very interesting. And again, please consider Broadlawns. It is, again, a hidden gem here in the city.